I think there are actually a lot of exciting presentations on CLL at this meeting. One indication of that was the fact that we are needing multiple overflow rooms for the oral presentations. But what I think is particularly interesting, and we're just starting to see this data, are combinations of small molecules with or without antibody. We have now 3 oral small molecules that are very effective drugs: ibrutinib, idelalisib, and most recently venetoclax. And I think that they're all really good drugs. But what we are particularly interested in is the question of, can we combine them? Can we combine them to get deeper and more durable responses? And can we have the potential for actually stopping therapy rather than giving the drugs continuously like we do right now with all 3 of them? So I think the early data on some of the combinations are very interesting. For example, the Germans presented last year on the run-in for their large randomized trial that they're doing in older patients or unfit patients with CLL frontline, which is chlorambucil obinutuzumab versus which is chlorambucil obinutuzumab versus venetoclax obinutuzumab. However, because they hadn't used that combination very much, the venetoclax obinutuzumab, they wanted to have a safety run-in. So just a small safety run-in, and they had some stopping guidelines. So last year at ASH, they presented in 13 patients that they hadn't met any of the stopping guidelines, and they then went on to start to accrue to their large randomized trial, which we don't have data from yet. But the update on those 13 patients from last year is that something like 10 of them are MRD negative within a year of therapy. So that's, I think, very exciting data to have that high a percentage of patients that are MRD negative, albeit in a small cohort. But there's also combination data being presented here of venetoclax and ibrutinib together, venetoclax, ibrutinib, obinutuzumab, just lots of combination data. Early data, but beginning to come out. Ibrutinib with, for example, checkpoint inhibitor. Nivolumab was the presentation I'm thinking of. So there's now checkpoint inhibitor data starting to emerge in CLL. So there's a lot of interesting combinations that we're just beginning to see some data from this year.